Hello, I'm Herb Silver, back with you talking about Breathing is the Key lecture series. Today, I'm going to briefly go over the nose and why the nose is the preferred breathing mechanism. Lots of us learned and lots of us think that doesn't matter how you get air into your lungs, breathe through your mouth, breathe through your nose. Does it matter? In fact, it does matter considerably when we actually make objective measures of our blood gases and oxygen dissociation, which we've talked about in other lectures. So when we're talking about the nose, what I want to introduce is some of the qualities of the anatomy of the nose that we want to enhance. And so I will go to a picture of the nose and we'll discuss these things. So the first thing to realize is that we have these the inferior, middle, and superior turbinates. And what these do, these are actually, interestingly enough, these are actually erectile tissue. And when as you're breathing in and out of your nose, there's a cycle going from the left side to the right side of your nose that's dictated by these turbinates. And these turbinates are erectile tissue that becomes engorged or unengorged, whatever the opposite of engorged is. And it controls the cycle of air going through our sinuses. If you check your sinuses and close off one side of your nose, you'll find that there's a cycle that one side of your sinuses are clear and the other side isn't. And it shifts about every 30 to 120 minutes, 2 hours, and that is dictated by the swelling or the lack of swelling in these turbinates. These turbinates also create a tortuous path through our sinuses so that there's eddy currents and swirls taking place as we breathe. And what that does is it allows the air to be purified, and it's purified through a release of nitric oxide from our upper palate. Nitric oxide, if you're not familiar with it, it's the most studied molecule in medicine. It dictates activity in all over our body. And nitric oxide is released from our upper palate, and it's a very powerful antiviral, antibacterial, and antifungal, as well as being a very powerful vasodilator. And it dilates not only in our sinuses, but our lung tissue, our alveoli. So as we breathe in through our nose and air goes through this tortuous path through our sinuses and is swirled around and purified by nitric oxide and warmed and humidified, there it then goes into our lungs, where it also dilates our lung tissue and influences the exchange of gases through our lung tissue, which we'll talk about a little later. So, memory points are that you have these turbinates in your nose that swell and dictate which side of your sinuses are dominant and which aren't, and that nitrous oxide is released to purify the air and humidify it, and that one final little tidbit, and we'll go over this in the techniques discussions, is that as we breathe,